My name's Scott Boden, and I've been at Emory University School of Medicine in Atlanta, Georgia for 33 years, really my entire professional career. I've had a number of positions in the department, both research and leadership positions, most recently as chair of the department, although I stepped down in January, and I currently serve as vice chair for professional development and innovation in the department. Yeah, so overview of my research career, I would say in the early stages, I was focused on appropriate use of advanced imaging, specifically MRI in the spine and knee and other areas, and developing diagnostic and treatment algorithms for low back pain that would be more efficient and more cost effective. In the middle part of my career, I was focused on understanding the biology of bone graft healing, particularly in spine fusion in a basic science level, looking at molecular biology and cellular signaling and how it impacted bone healing. Then in preclinical models that we developed both in the rodent and in non-human primates, and then clinical validation. So really kind of a bench to bedside kind of story for a variety of things that either enhance or actually slow down bone healing. And then in the later stage of my career, I've been focused on design of small molecules for more cost-effective bone and cartilage regeneration opportunities. Also, the use of cell-based therapies for arthritis in patients, and the use of virtual reality and augment and AI to predict musculoskeletal injury risk and potentially implement preventative interventions to decrease the risk of sports injuries in youth athletes. So initially, it seemed like that there were a whole variety of clinical treatments for the same problem with a lot of variability between surgeons. And this was even in my own training. And I started asking questions and realized that a lot of the clinical treatment decisions weren't really based on data or they were based on outdated assumptions. Um, that was one thing that stimulated my early interest in orthopedic research. It also seemed to me that orthopedics wasn't taking advantage of the latest science and research tools to understand the biology of bone regeneration. We were focused a lot on biomechanics and just histology, looking at tissues. And this is now back in the early to mid 1990s when I started my career. And then third, I really enjoyed connecting with colleagues and building teams outside of the clinical treatment arena and outside of the operating room. That was a lot of fun for me, and so that was another aspect of research that really kind of brought me to it and kept me going. And then lastly, really love to ask and answer questions that other people haven't asked or answered before. Would say that some of the biggest challenges in my research journey were funding high risk research areas. And a lot of times you almost have to have the work done before you can get the funding for it. And so that's always a bit tricky. And then I would say another challenge is getting unexpected results and then having to adjust your hypothesis. But sometimes it's the unexpected results that lead to some of the most interesting discoveries and observations. I would say, getting the Kappa Delta Award was probably one of the things I'm most proud of for our team, partly because it was awarded for a body of work, not just a single project or a paper. And again, it looked at sort of bench to bedside of understanding, bone regeneration and bone graft healing. And some of the animal models that we developed have now been reproduced on multiple continents and become a gold standard with the FDA and with other investigators. And that's really fulfilling to see, something that in the beginning was not very glorious developing a model. But in the end, because we took our time with it and really characterized it, it turned out to really be a workhorse and help accelerate moving a lot of things, into actual human use. And then more recently, discovering some new genes and small molecules that are capable of turning on bone and cartilage formation is something that I'm also proud of our team. Think in general, moving towards a more personalized medicine approach in orthopedic research is going to be interesting to better predict, patients that are going to be responders or non-responders to various treatments. because as the cost of healthcare goes up and up, if we can sort of not waste time on expensive treatments and people that are less likely to respond, we can not only personalize treatments and hopefully have a higher success rate, but we can also avoid kind of wasting precious healthcare dollars on things if we know there's a low chance of them working. Yeah, so first I'll give you an example about clinical decision making and then potentially impact on clinical care. So some of my earlier work was observing the false positive rate on MRI scans. This is when MRI was pretty new and everybody thought it was such a clear picture that when they saw something, it must be clinically relevant. But one of my older but more quoted studies, observed that 98% of people over age 60 that had no back pain actually had multiple levels of degenerative disc changes. And 28% of younger people had actual herniated discs on their MRI scan that were totally asymptomatic. And so the whole idea in terms of clinical decision making that even with a very anatomically accurate imaging study, such as an MRI scan, that it was critically important to correlate, clinical symptoms with the specific findings before triggering an intervention, just because there are a lot of asymptomatic individuals with findings or false positive findings. And then in terms of influencing clinical care, having had a major impact in fine-tuning the dosing strategy and the carriers for successful delivery of bone morphogenetic proteins in humans is something that's really revolutionized the ability to get bone to heal in tough situations. And I think that's, had an impact on hundreds of thousands of patients since, recombinant BMP was first approved back in 2002, so over 20 years ago now. On a general basis, I think how we predict patients that have poor bone healing potential and therefore need extra and maybe more, resource intensive means would be really helpful to know out of the gate. And then secondly, I think, and this is sort of an age-old challenge, and that is if we can better segregate and understand the causes of low back pain, we can be much more specific and accurate in our treatments, because we're pretty good at treating leg pain and instability, but we're still not so good at treating back pain, and it's one of the most common reasons that people visit their physician, visit a physician. So I think there's four reasons that investing in orthopedic research is, more important now than ever. First, the burden of musculoskeletal diseases is massive, and as people live longer and expect to be more functional, that burden is continuing to rise. Secondly, we need new treatments. There are a lot of things that we don't have treatments for. Third, we need more effective treatments for some of the things we're already trying to treat. And fourth, and most importantly, we need cheaper treatments. Healthcare is getting too expensive. And with the burden of musculoskeletal disease, we don't want orthopedics to be some massive consumer of healthcare resources, even though a lot of what we do is well substantiated. And so I think only continued investment in orthopedic research is going to allow us to address, these four needs.